Andrea, a 40-year-old woman, presents to her physician after coughing up blood several times in the past week. She reports she has been coughing more frequently and experiencing difficulty finishing her daily walks, despite the fact that she recently stopped smoking. She has not noticed any significant changes in her urinary habits. Physical examination is notable for the following blood pressure. There is also an absence of fever and tachypnea. X-ray of the chest demonstrates fluffy infiltrates bilaterally. Urinalysis reveals proteinuria, hematuria, and RBC casts. A spot protein creatinine ratio shows significant subnephrotic range proteinuria. What is the most likely diagnosis? Rapidly progressive glomerulonephritis and alveolar hemorrhage suggests GoodPasture Syndrome, or an antineutrophil cytoplasmic vasculitis, such as Wegener granulomatosis or microscopic polyangiitis. Some antibodies have been tested for by serology, but only antiglomerular basement membrane antibodies were isolated from the patient's serum. What is the epidemiology of the associated condition? Isolation of anti-GBM antibodies suggests GPS, which is a form of anti-GBM disease characterized by rapidly progressive glomerulonephritis and alveolar hemorrhage as a result of autoantibodies to collagen type 4. GPS has a prevalence of 1 in 1 million, and it occurs with hemorrhage in 40 to 60% of cases. Males between 5 to 40 years of age are the most commonly affected, and both genders are affected equally in older adults, but patients younger than 30 years of age are more likely to be severely affected. Untreated GPS has a fatality rate of 50%. What is the pathogenesis of this condition? IgG autoantibodies against collagen type 4 are the distinguishing feature of GPS, and they also correlate with the severity of the disease. The expression of alpha-3 chains of type 4 collagen is highest in glomerular and alveolar basement membrane. The antigen targets of GPS autoantibodies are normally inaccessible because of the presence of endothelial cells. The exposure of these antigens to circulating antibodies is more likely in the kidneys and lungs because of the fenestrated nature of the endothelial lining of glomerular capillaries and the increased susceptibility of lungs to injury. For instance, patients with GPS who have lung infections, are smokers, or have other toxic inhalations are more likely to have pulmonary involvement in their disease due to the endothelial damage and exposure of the basement membrane antigens. What type of hypersensitivity reaction is responsible for this patient's disease process? Fixation of the complement to the anti-GBM antibodies activate the classic complement pathway that results in the recruitment of neutrophils and monocytes. Type 2 hypersensitivity is also seen in myasthenia gravis, pernicious anemia, Graves' disease, pemphigus vulgaris, and other conditions.
This is it. This is our destiny. Again, thank you so much. If you like it, please subscribe. See you next time. Bye.